Hello everyone, welcome to the new series of videos on forensic medicine and toxicology. So I'm going to start from the chapter Impotence, Sterility, Virginity, Pregnancy and Delivery. These chapters comes under the second part of forensic medicine. In the upcoming videos, I will cover the rest of the chapters, then the first a few introductory topics of forensic medicine, and at last toxicology. So these videos are made exclusively for your university exams. I'm not going to talk topics in detail. I'm just going to say you the hints, the important points that you have to remember, important points that you have to note for your multiple choice questions. Okay, any special case scenarios which can be asked for your forensic medicine theory as well as practicals, and as well as some important images which are very commonly or very frequently asked for your practical exam. So let us start with the chapter Impotence and Sterility. Here you have to understand what is the definition of impotence. Remember, impotence and sterility are two different terms. Impotence means it is an inability of the person to perform a sexual intercourse, whereas sterility means it is the inability to conceive children, okay, in case of female, or male to beget children. Fine? Okay. There is a term which is very frequently asked called frigidity. It is nothing else but inability to initiate the sexual arousal pattern in the female. It is actually a homologous terms to impotence. What do you mean by premature ejaculation? That is before or just after sexual penetration, there will be ejaculation. We call it as premature ejaculation. And so what are the causes of impotence? Okay, what are the causes of impotence that you have to remember? And what is the medico-legal impotence? There is civil impotence and criminal impotence. Civil, for example, nullity of marriage, divorce, okay, disputed paternity and legitimacy. These are the three important things you have to remember. And criminal, remember adultery and rape. As far as causes is concerned, you have to rule out the causes. It may be either congenital causes, acute causes. That is how we are broadly classifying. Okay. Then coming into the other causes of impotence and sterility in the male. Number one, age. Just remember the headings. There is no need for you to remember each point by point, especially in these topics. Okay, age. And remember a condition called McCune-Albright syndrome. Okay, McCune-Albright syndrome, in which there will be precocious puberty, or there may be any defect of development and acute abnormality. Okay, for example, there will be because of any cryptorchidism or in a testicular carcinoma, there will be removal of the testis in an early age. That will again leads to infertility. But at the same time, since there is no problem with the penis, what will happen? The potency is retained in such conditions. Or because of any local diseases like hernia, hydrocele, phimosis, paraphimosis. Okay, these are the important conditions that you have to remember. Or any general illness. What are the general illness? For example, any conditions of the central nervous system like hemiplegia, syringomyelia. Okay, and remember, there is a condition called ceriasis. What do you mean by ceriasis? It is excessive sexual desire. All these terms are important. They are very frequently asked as MCQ questions. Or any psychological causes. As far as I will tell, psychological causes is the most common cause of temporary impotence. Okay, fine. What do you mean by quad hoc? That means an individual who may be impotent with one particular woman but not with others. Fine? Okay. And what is the most important or the frequent cause of erectile failure? It is the vasculogenic cause. It is the vasculogenic cause. What are the causes of impotence in the female? Again, age is a factor. Then coming into defects of developmental acute abnormality. For example, any Mullerian duct anomalies, Turner syndrome, local diseases, okay, any tuberculosis of the fallopian tube, general diseases, and psychological causes. What do you mean by vaginismus? Vaginismus is nothing else but the spasmodic contraction of vagina due to hyperesthesia. Okay, it is a spasmodic contraction of the vagina. Okay. Coming into sterilization. Here, I would like to just tell about artificial insemination. What do you mean by artificial insemination? Artificial introduction of the semen into the vagina or cervix or uterus to produce pregnancy. That is actually called as artificial insemination. It is a very frequently asked question, so I would like to discuss a bit detail. Remember, what are the different types of artificial insemination? We have two types, or some books like three types. One is artificial insemination of husband, artificial insemination donor and artificial insemination husband donor. That means first the husband will be donating the semen. In second, a donor will be donating the semen. In third, there will be a combination, pooled semen from both husband and donor. What is the biological aspect of this? Remember, after masturbation, the semen will be obtained using a syringe. It will be deposited in the cervix. Remember, the ovum can survive in a fertilized form only for about 24 hours. Okay, and the sperm takes around 6 to 24 hours to travel from the vagina to the fallopian tube, and fertilization will take place. Remember, there is around 70 to 75% success rate. Okay, in case of artificial insemination. What are the indications? For example, when the husband is impotent, when the husband is unable to deposit the semen because of any hypospadias, when the husband is sterile, whenever there is an RH incompatibility between the husband and wife, or when the husband is suffering from any hereditary diseases. Fine? Yes. Why we should read about what is the medico-legal importance of artificial insemination? Number one, adultery. Number two, legitimacy. That means the husband is not the actual father of the child, and as such the child is illegitimate and cannot inherit the property. Third is nullity of marriage and divorce. Okay. Fourth is natural birth. Then fifth is unmarried woman or a widow may have a child from artificial insemination, but again the child will be illegitimate. And remember, there is a risk of incest between the children born by artificial insemination and children of the donor, but this is not an offense in India. Fine? Okay. So this finishes the important questions in this chapter. Here once again I am reinforcing on the topic artificial insemination. We have three types. Remember what are the indications. Okay, what is the medical legal importance? Adultery, legitimacy, nullity of marriage and divorce, natural birth, unmarried woman or widow, incest. Then you have to remember about what are the causes of impotence, okay, and sterility in male and female. What does the term impotence mean? What do you mean by frigidity? What do you mean by premature ejaculation? What do you mean by vaginismus? What do you mean by ceriasis? What is the most common cause of temporary impotence? It is psychological causes. What is the most frequent causes of erectile failure? It is the vasculogenic impotence. Okay, fine. And what do you mean by vaginismus? It is a spasmodic contraction of the vagina due to hyperesthesia. Once this is done, let us discuss about virginity, pregnancy and delivery. Out of this, the most important topic is virginity. What do you mean by true virgin? What do you mean by false or pseudo virgin? Okay, what are the different types of hymen? So these are the questions that are very frequently asked from this chapter. Okay, and I would like to write those questions here. Number one is true versus false virgin. Then next is types of hymen. And next is definitive signs of pregnancy. Definitive signs of pregnancy. I would like to discuss only these things, and in addition I will just mention about some important multiple choice question. What do you mean by virgin? A female who has not experienced sexual intercourse. And what do you mean by loss of virginity? Called as defloration. Defloration. So remember, marriage is a contact between man and woman which implies just a physical union by coitus. Okay, fine. So, just I would like to give an brief idea about the external genitalia of the female. Remember, we have two labia majora. Within that, we have labia minora, okay, which is attached posteriorly by what we call as forcet, and the forcet and vaginal orifice. In between that, we have a depression which we call as fossa navicularis, and we have something called as clitoris, which is almost homologous to the penis in female. Okay, clitoris is very sensitive. It has very rich blood supply as well as nerve supply. Okay, have very fine nerve endings. And the mons pubis, clitoris, labia majora, minora, hymen and urethral opening are together called as vulva. We have two openings. One is the vaginal opening and the anal opening, out of which vaginal opening is the one which is important here. Remember, hymen. What do you mean by hymen? It is nothing else, it's a mucous fold, okay, which is situated at the vaginal outlet. And we have different types of hymen. I would like to mention, I will explain it in very soon. And what are the different types? One is the semi-lunar or the crescentic type, which is actually the commonest type. See, this is the semi-lunar or the crescentic type of the hymen, which is the most common type of hymen. Remember, there is another type called annular, infantile, cribriform, vertical, septate, microperforate, fimbriated, imperforate. Imperforate hymen means there won't be opening. Imperforate hymen, the females will present with cryptomenorrhea. What do you mean by cryptomenorrhea? There will be menstrual bleeding, but the menstrual blood won't come outside. Okay, fine. So it will be usually, that is, there will be a bluish hue on the vulva. Fine. What do you mean by fimbriated hymen? That means there will be irregular or multiple notches will be present. This fimbriated hymen can be mistaken for artificial tears during intercourse or during a case of rape. We are examining the victim. Okay, we may mistake this fimbriated hymen, okay, for artificial tears. Coming to what are the causes of rupture of a hymen. Number one, an accident, okay, using a vaginal tampon or riding a horse, everything. Second is by masturbation. That is why rupture of hymen is not an indication of virginity. Fine, okay. Then masturbation using surgical operation, any foreign body like vaginal tampons and scratching, okay, sanitary tampons I have already told. Fine. So what is the difference between virginity and defloration? Virginity, the hymen means it is intact, rigid and inelastic. It may be torn or intact. That is what I told. Okay, that means in defloration, it doesn't mean there is a rupture of hymen is not an indication. Okay, rupture of indication. So that means what to say, in a deflorated female, also the hymen may be intact. That is what I want to say again. Labia majora will be adjacent to each other. They are not opposed to each other in case of defloration. Labia minora, they are in contact. They are not in contact in defloration. Forceps, fossa and avicularis, everything will be intact here. It will be torn, okay, or it disappears in case of defloration. But remember, the vagina is usually narrow in virginity, and because of repeated intercourse and defloration, it will be increased in length. Okay, what are the... Remember, that is unruptured hymen is not an absolute proof of virginity. That means if the rupture is if the hymen is unruptured, it doesn't mean that she is virgin. Fine, that is what the point I would like to stress hereafter. Okay, why? Because we have different variants of hymen. No, out of that I told you the fimbriated hymen, which will looks like a artificial tears. So we should not mistake it as like, okay, the hymen has ruptured. Okay, fine. What are the principal signs of virginity? Extremely important question. Extremely important question. Number one, an intact hymen. Number two, a narrow condition of the forceps and the posterior commissure. Number three, narrow vagina. Okay, if all these three are present, then only we can say, okay, she is virgin. Fine? Okay. In this, I would like to mention what are the causes of rupture of hymen. You should remember the different types of hymen. What is hymen? What is fimbriated hymen? What is its medico-legal importance? Okay, what is the difference between virginity and defloration? Then, okay, I told you, remember this point, very, very important point. What is it? The presence of unruptured hymen is a presumption, but is not an absolute proof of virginity. Then coming into pregnancy. In pregnancy, we have something called as presumptive signs of pregnancy, probable signs of pregnancy, and positive signs of pregnancy. Out of this, I would like to mention here one important MCQ question. During pregnancy, there will be bluish hue, okay? There will be bluish discoloration of the vaginal walls. This is actually called as Jacquemus sign or Chadwick sign. Jacquemus sign or Chadwick sign, okay? Just remember that important point there. Once that is done, let us go for what are the positive signs of pregnancy. What are the positive signs of pregnancy? Okay. 1 second. See, what are the positive signs of pregnancy? That means if this is present, she is pregnant. Okay, these are the definitive signs of pregnancy. Number one, fetal pulse and movements, which are felt by placing the hands on abdomen by 24 weeks. On auscultation by 18 to 20 weeks, if we are able to hear fetal heart sounds. Okay, suppose if the fetal heart sounds are not here, what does it mean? The fetus may be dead, there may be excessive contact of the liquor, I mean the abdominal wall is very thick, or we have done the examination before 80 weeks. Okay, only 18 to 20 weeks we can get the we can hear the heart sound by using normal stethoscope. Placental shuffle, okay, which is nothing else but a soft murmur heard over the placental site. Umbilical shuffle, which is nothing else but the blood flow in the umbilical cord. Okay, and next is ultrasonography. Okay, ultrasonography, we are finding the fetus, means it is a definitive sign of pregnancy. Fine. Okay, here we have to come across certain important terminology. Number one is actually what is called as pseudocysis, spurious or phantom pregnancy. Number two, posthumous child. Number three, superfecundation. Number four, superfetation. Okay, then, okay, we will discuss it. What do you mean by pseudocysis, spurious or phantom pregnancy? A woman who has intentional desire to have a child, but she is not pregnant, but she will act, or she will, she will say the compliance that of a pregnant lady. Okay, this is actually called as pseudocysis or spurious or phantom pregnancy. She is not pregnant in reality, But she will have the compliance of a pregnant woman. She will say, no, I am hearing my fetal heart sounds. Okay, I am hearing the quickening movements, everything. This is actually called pseudocysis, spurious or phantom pregnancy. What do you mean by posthumous child? A child born after the death of its father, the mother being conceived by the said father. This is called a posthumous child. Here comes another two terminology called superfecundation. That means, and superfetation. What do you mean by superfecundation? Same period, two ova has been discharged from the ovary. Those two ova has been fertilized at the same period, but two separate act of coitus committed at short intervals. Okay, here what will happen? Both, okay, child will start developing. Okay, there is both zygote, embryo, everything will start developing, but one will be flattened, one will be dead. That is actually called a fetus compressus or fetus preparaceus. Okay, you have to know the picture of fetus compressus or fetus preparaceus, which is a very commonly asked spotter in your university exam. What do you mean by superfetation? Already a woman is pregnant. There is a fertilization of a second ovum in a different, through a different act of coitus in another time of menstrual cycle. That is actually called a superfetation. In already pregnant women, whenever there is a fertilization of a second ovum, we call it a superfetation. Okay, what is it? Superfetation. Just remember these terms. Okay, they are not asked as a shortened question, but you should know what is superfetation and what is superfecundation. What do you mean by legitimacy? The legal state of a person born in a lawful marriage. What do you mean by illegitimacy? The child becomes illegitimate, or we call it as bastard, that if it can be proved that the husband could not possibly be the father of child by producing evidence that the alleged father is under the age of puberty, physically incapable to beget children, did not have access to wife during the time that the child was begotten, or the blood groups of the child and alleged father are not compatible. Fine? Okay. What do you mean by supposititious child? It means a fictitious children. A woman may pretend pregnancy and delivery and later producing a living child as her own, and she may substitute. That means, what to say, as we can see in some movies, a woman will be bringing a child and she will be telling, no, and another person is the father of her child. Okay, that is called supposititious child, also called as fictitious child. All these are mainly for what? Acquiring any property, okay, or with any other criminal intentions. Okay, fine. What do you mean by atavism? The child won't resemble parents, but they will resemble grandparents. Okay, that is called atavism. This mainly occurs because of the mutation, Mendelian inheritance. Fine? Okay. What do you mean by wife battering? A battered wife. We have something called battered baby syndrome. Like the battered wife is a woman who has received deliberate, severe, and repeated demonstrable physical injuries from her husband. And the old men know that means that usually the accused may be having some psychotic or neurotic disorder. Okay, that is called wife battering. Fine. So in this chapter, you should just be familiar with the terms legitimacy, illegitimacy, supposed child, superfecundation, superfetation, spurious pregnancy or phantom pregnancy, definitive signs of pregnancy. Okay. That's all. Then virginity, defloration, types of hymen. Okay, remember, very, very important point. I'm stressing it again. Presence of unruptured hymen is a presumption, but it's not an absolute proof of virginity. So with this, we have finished, we have come to the end of these two chapters. I have just discussed what are the important, areas that you have to focus. Just read the points, okay? There is no need that you have to mug up each and every point. Just be precise, you understand what are these terms means, okay? And keep it in your mind. Thank you.